Hello, my name is Dr. Shubhadeep Das. I'm a consultant in pediatric cardiac and general ICU at Narayana Superspeciality Hospital, Howrah. Today, I'm going to discuss with you a few things about a disease called MISC, which you might have heard of recently in newspapers. MISC is basically Multisystem Inflammatory Syndrome of childhood, which is related to COVID-19 infection. So I don't look down upon it as a direct effect of COVID, but probably an effect of COVID or an alteration done by COVID in the body's immune system. So a body develops a resistance against its own self, as in all the organs of the body may be affected, and that's why the term multisystem. So how would you identify the signs and symptoms of this disease? Basically, the symptoms can be overlapping and sometimes in the initial phases can be very confusing for the parents. As in, it can present with high grade fever to the order of 103 to sometimes 104 degree Fahrenheit. At the same time, whenever you find that along with this fever, your children are having rash, which may be kind of reddish distributed at any portion of the body, but maybe more preferentially in the mouth, over the face. There may be some redness of the eyes, there may be some redness of the lips. So always be alert and consult a nearby pediatric physician. Fortunately, this disease, if identified at appropriate time, has got very good treatment, and most of the children in our hospital, at least most of the children that we have treated, we have been able to successfully send them home. And also in worldwide literature, MISC generally has a very good outcome. But if not properly treated, the disease, as I have already mentioned, is called multisystem. One of the most critical organs that it affects is your heart. So it can actually lead to quite serious damages of the heart, to the point of having some heart blocks, the cardiac function becoming very poor. And we recently have had at least 2 children where we needed to implant permanent pacemakers because of their disease process. So during these times, we have to have a very high degree of suspicion about this disease, and whenever your children is suffering from this kind of symptoms I just mentioned about, then always be alert and consult a pediatrician. Thank you.